Hey Alpha Nurses, I'm Nurse Sandra from alphanurseguide.com. This is NCLEX PN Review Lesson 28. We're going to be doing cardiovascular medication questions. As always, you guys can follow me on Facebook, Instagram, and TikTok to get any updates. All links are in the description. Without the way, let's get started.
Question 1. The nurse is planning to administer amlodipine to a client. The nurse should plan to check which before giving the medication. A. Respiratory rate. B. Blood pressure and heart rate. C. Heart rate and respiratory rate. D. Level of consciousness and blood pressure. The correct answer is B. Blood pressure and heart rate. Rationale: amlodipine is a calcium channel blocker. This medication decreases the rate and force of cardiac contraction. Before administering a calcium channel blocking agent, the nurse should check the blood pressure and heart rate, which could both decrease, in response to the action of this medication. This action will help to prevent or identify early problems related to decreased cardiac contractility, heart rate, and conduction. Question 2. A client who has begun taking fosinopril is very distressed, telling the nurse that he cannot taste food normally since beginning the medication 2 weeks ago. Which suggestion would provide the best support for the client? A. Tell the client not to take the medication with food. B. Suggest that the client taper the dose until taste returns to normal. C. Inform the client that impaired taste is expected and generally disappears in 2 to 3 months. D. Tell the client that a request will be made to the healthcare provider to change the prescription. The correct answer is C. Inform the client that impaired taste is expected and generally disappears in 2 to 3 months. Rationale: ACE inhibitors, such as fosinopril, cause temporary impairment of taste. The nurse can tell the client that this effect usually disappears in 2 to 3 months, even with continued therapy, and provide nutritional counseling, if appropriate, to avoid weight loss. Options A, B, and D are inappropriate actions. Taking this medication with or without food does not affect absorption and action. The dosage should never be tapered without HCP approval, and the medication should never be stopped abruptly. Question 3. The nurse is preparing to administer Digoxin, 0.125 mg orally, to a client with heart failure. Which vital sign is most important for the nurse to check before administering the medication? A. Heart rate. B. Temperature. C. Respirations. D. Blood pressure. The correct answer is A. Heart rate. Rationale: Digoxin is a cardiac glycoside that is used to treat heart failure and acts by increasing the force of myocardial contraction. Because bradycardia may be a clinical sign of toxicity, the nurse counts the apical heart rate for 1 full minute before administering the medication. If the pulse rate is less than 60 beats per minute in an adult client, the nurse would withhold the medication and contact the healthcare provider. Question 4. A client who is taking hydrochlorothiazide has been started on triamterene as well. The client asks the nurse why both medications are required. Which response is the most accurate to give to the client? A. Both are weak potassium-excreting diuretics. B. The combination of these medications prevents renal toxicity. C. Hydrochlorothiazide is an expensive medication, so using a combination of diuretics is cost-effective. D. Triamterene is a potassium-retaining diuretic, whereas hydrochlorothiazide is a potassium-excreting diuretic. The correct answer is D. Triamterene is a potassium-retaining diuretic, whereas hydrochlorothiazide is a potassium-excreting diuretic. Rationale: potassium-retaining diuretics include amiloride, spironolactone, and triamterene. They are weak diuretics that are used in combination with potassium-excreting diuretics. This combination is useful when medication and dietary supplement of potassium is not appropriate. The use of 2 different diuretics does not prevent renal toxicity. Hydrochlorothiazide is ineffective an inexpensive generic form of the thiazide classification of diuretics. Question 5. The nurse is caring for a client who has been prescribed furosemide and is monitoring for adverse effects associated with this medication. Which should the nurse recognize as potential adverse effects? Select all that apply. A. Nausea. B. Tinnitus. C. Hypotension. D. Hypokalemia. E. Photosensitivity. F. Increased urinary frequency. The correct answers are B. Tinnitus, C. Hypotension, and D. Hypokalemia. Rationale: furosemide is a loop diuretic, therefore, an expected effect is increased urinary frequency. Nausea is a frequent side effect, not an adverse effect. Photosensitivity is an occasional side effect. Adverse effects include tinnitus, hypotension, and hypokalemia. Question 6. The nurse provides medication instructions to an older hypertensive client who is taking 20 mg of lisinopril orally, daily. The nurse evaluates the need for further teaching when the client makes which statement? A. I can skip a dose once a week. B. I need to change my position slowly. C. I take the pill after breakfast each day. D. If I get a bad headache, I should call my healthcare provider immediately. The correct answer is A. I can skip a dose once a week. Rationale: lisinopril is an antihypertensive angiotensin-converting enzyme inhibitor. The usual dosage range is 20 to 40 mg per day. Adverse effects include headache, dizziness, fatigue, orthostatic hypotension, tachycardia, and angioedema. Specific client teaching points include taking one pill a day, not stopping the medication without consulting the healthcare provider, and monitoring for side effects and adverse reactions. The client should notify the HCP if side effects occur. Question 7. A client complaining of not feeling well is seen in a clinic. The client is taking several medications for the control of heart disease and hypertension. These medications include a beta blocker, Digoxin, and a diuretic. A tentative diagnosis of Digoxin toxicity is made. Which assessment data supports this diagnosis? A. Dyspnea, edema, and palpitations. B. Chest pain, hypotension, and paresthesia. C. Double vision, loss of appetite, and nausea. D. Constipation, dry mouth, and sleep disorder. The correct answer is C. Double vision, loss of appetite, and nausea. Rationale: double vision, loss of appetite, and nausea are signs of Digoxin toxicity. Additional signs of Digoxin toxicity include bradycardia, difficulty reading, visual alterations such as green and yellow vision, or seeing spots or halos, confusion, vomiting, diarrhea, decreased libido, and impotence. Question 8. A client is being treated for acute heart failure with intravenously administered bumetanide. The vital signs are as follows: blood pressure 100/60, pulse 96 beats per minute, and respirations 24 breaths per minute. After the initial dose, which is the priority assessment? A. Monitoring weight loss. B. Monitoring temperature. C. Monitoring blood pressure. D. Monitoring potassium level. The correct answer is C. Monitoring blood pressure. Rationale: bumetanide is a loop diuretic. Hypotension is a common side effect associated with the use of this medication. The other options also require assessment but are not the priority.
That's all I have for this video. Please like, share, let me know if you have any questions. If not, I'll see you in the next video. Thanks for watching.